WHO's assessment is that the risk of monkeypox is moderate globally.
Yes, this should be declared an emergency now.
The world seems to be in the grips of a new deadly disease. After COVID-19, its variants, and talks of disease X in Britain, WHO has now sounded alarm over monkeypox. The WHO declared it to be a public health emergency of international concern on July 23rd. This is the highest level of alert issued for any disease by the global health body. This year, there have been around 16,000 confirmed cases of this disease in over 75 nations, with Africa being the most affected. India too has reported 4 cases of monkeypox. 3 are from Kerala and the 4th is from New Delhi. 1 more suspected case has been reported from Telangana today. The 3 confirmed cases from Kerala had a foreign travel history, but the person from Delhi had no recent history of international travel. However, he did visit Himachal Pradesh just a while back. This probably alludes to local transmission and has now got the attention of Union Ministry of Health and Family Welfare. Today in this video, we take a look at the probable origins, symptoms of this disease and the most recent official update on it up until today. Monkeypox is not a new disease, as is the general perception. It got its name from an outbreak in 1958 among a group of monkeys who were being tested inside a research facility in Denmark's Copenhagen. It is a viral zoonotic infection, which essentially means that it is mainly transmitted from animals to humans. Men and monkeys are both accidental hosts, and wild rodents are usually believed to be harboring this virus. 2 strains of monkeypox have been isolated. These are the Western African strain and the Central African strain. The West African strain is the one that is currently spreading across the world. It spreads from person to person through close contact with someone who has a monkeypox rash. However, with cases being diagnosed among men who have sex with men or MSM, sexual transmission is also becoming a dominant factor. But at this point, there is no consensus among health experts and epidemiologists to conclude that this is an STD or it only spreads through sexual mode among men. WHO has flagged LGBTQ community and MSM to be more at risk with monkeypox. Other than the possibility of sexual transmission, human-to-human transmission is known to occur primarily through large respiratory droplets. Unsafe blood transfusion can also lead to monkeypox in some cases. The Union Health Ministry has said that it can also be transmitted through direct or indirect contact with body fluids or lesion material, such as through contaminated clothes or linen. Its symptoms are similar to smallpox, although they are less severe. The most common symptoms include fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes, along with pox rashes that last for 2 to 3 weeks. Monkeypox is a self-limiting disease with low mortality. Only 5 deaths have been reported this year so far. That is the reason probably the world is not panicking yet. Most children and adults with healthy immune systems will not, even if they are infected, come down with severe illness. However, it can lead to death, especially in children and those with weak immune systems. Vaccines for smallpox are also believed to reduce the spread of monkeypox. Besides, there are 2 specific vaccines for monkeypox. These are the MVA vaccines and the ACAM 2000 vaccine. But their supply is constrained. As far as India is concerned, it currently does not have any vaccine for it, since the stockpile of smallpox vaccine was abandoned after smallpox was eradicated from the country. Union Health Ministry has also held a high-level meeting and has issued a certain directions to states that includes directives to intensify surveillance and contact tracing. These were the relevant and recent updates about monkeypox and its status in India at present. Do like, share and subscribe for more such recent updates. Thanks for watching.
Subscribe to Oneindia channel and never miss an update.